a 78! Help! No! Step it up. I need more cores. Stay with me. Which one? 1-1, Blanford now, still walking westbound. Okay, 1-2, walking westbound on Blanford Street, check the radio circle. Get back now. Sir, black man carrying in blue. Sir, with you. That's one.
1100. I shot at suspect. I'm shot. Start medic to me.
6-9. Hey, take me to University of Chicago.
Send EMS. I got hit. Hey, come here. Clear. Push. Tighten that. Tight. Come on. Wrap it around. Stop.
Right, my friend. I don't know. You hit my friend.
That's all right. Stay down. 2451 West 245 West 46.
Ronnie's down. Officer's down. Ronnie's down. Put your hand down. I've been around trauma care and trauma-related injuries for something like 16 years. 4 years in the Marine Corps Infantry, 2 years as a nuclear security officer, and almost 10 years as a police officer in a major city. Obviously, the majority of that exposure has come through practical application and training, which is a good thing. Some real-world exposure in Afghanistan as a Marine, and a lot of exposure as a police officer in a major city over the course of 10 years. If you become a police officer in a major city, or you already are one, then you know that you're going to see a lot of people who are hurt in a lot of different ways. That means that you need to be capable of providing the proper medical attention so that you can save these people's lives. And also, probably an important aspect is being able to provide that same level of care to yourself so that you can save yourself. I am in the process of creating my own IFAC, which I've already been testing out on the street. So if that's something that interests you when it does come out later in the future, go to the website, the link's in the description, and put in your contact information, and you'll be notified of when that becomes available for you to purchase. I'm gonna gloss over some things. I'm gonna talk about tourniquets, I'm gonna talk about chest seals and gauze, but there are a few things that I wanna pay particular attention to because these are problems that I see out on the street. The first thing is, as an individual officer, if you live by that slogan of nobody is coming for you, like people like to throw out there, then you need to be capable of providing your own level of care, your own trauma care to yourself. And that's what you should be expecting to do. And the reason that you should be expecting to do that is because although you may have additional officers who are close by or coming to assist you, you don't know most of the time what their capabilities are. So you don't know if they're going to apply a tourniquet correctly. You don't know if they're going to expose the wound, which I'm going to get to here in a second, identify the problem, and treat that problem in a timely manner. If you go on the Instagram, you'll see it says capable individuals at the top. If you go to my website, you'll see on the homepage it says capable individuals at the top. That's what this is about, providing you all with the information you need to become a capable individual. Now, that isn't going to be learned through a video on YouTube, okay? You are going to have to actually do these things in training, or at least put intimate thought into these things at home, pull out your tourniquet and look at it and think about your process and how you would do these things so that you can actually be a capable individual. Now, one of the issues that I see is officers get shot, and I understand that you're hurt and I understand that it sucks. But if the threat is down or the threat is away and now you're getting yourself to safety, you need to expose the wound, okay? Obviously, if you're shot once and you know you're shot once and you see that your leg, you need a tourniquet, put on a tourniquet. If you're shot in the torso and it's safe, threat's down or threat's away, and you can get to safety, you need to take your vest off. You need to take your belt off and take your shirt off. You need to expose the wound so that when the additional officers get there, they're not trying to figure out what's going on, okay? Because maybe you're unconscious at that point. Maybe you can't tell them where you're hurt. Or even if you do tell them that you're shot in the torso, now they're having to take all your stuff off to get to the wound, which is costing you time, and that's time that you don't have. So if you're gonna be a capable individual, you need to understand these things so that firstly, you can help yourself. Providing the only level of care that officers are authorized to provide and have at least been trained at some level to provide is not a difficult thing to do. All of these things are very basic. However, we still see officers screwing this thing up consistently, and it's a problem. Now, I've told you that for 16 years I've been exposed to this stuff, and I've applied tourniquets in the real world. So there is not a situation that exists where, even without continued training on tourniquets, that I'm going to see somebody that needs a tourniquet and not be able to provide that tourniquet or apply that tourniquet adequately and appropriately. So I'm going to go over my process for applying tourniquets, because when you have a process for completing tasks, then you get predictable outcomes. The problem, one of the problems, is that officers have these things on them and then they pull it out when they see, potentially a problem that they need to use a tourniquet for, and it's a whole new thing to them, right? So first of all, if you're not using a cat tourniquet, I don't know why you would not be, okay? They're very easy and very simple to use, and they're almost dummy proof, okay? Very hard to screw up. And because they are Velcro, it's just assisting you and helping you apply pressure to the limb without even utilizing the windlass, which is one of the things that people screw up. But I'll start at the beginning. First of all, when I pull out a tourniquet and I've identified this person needs a tourniquet, I'm looking for a heavy flow of bright red blood, and it's usually pretty obvious. I've seen people where there was a lot of blood and they had lost a lot of blood, and just so happened in that situation, it was a kind of like an elderly female that was shot by a bystander. She was in her apartment or sitting outside her apartment. Two idiots were shooting at each other. She got hit in the leg. When I got there, the family had utilized towels and things like that, but the firefighters were already there. So obviously that's their problem to deal with, and I'm just observing. And they did not put on a tourniquet on her, although she probably had an arterial bleed at some point. And the reason that they didn't put one on, according to them, is because it had already coagulated. Whatever they were doing stopped the flow of blood, or it kind of stopped on its own through direct pressure, and so a tourniquet wasn't needed. So this is really important, because I've talked to EMTs, and one of the issues that they have or that they see consistently is officers putting on tourniquets when they're not necessary. I've seen this myself, and it kind of bugs me, to be honest with you. It's usually pretty obvious that the person needs a tourniquet, and you will know, okay? We don't want to apply tourniquets to people that don't need them, right? That's not the right level of care. If it doesn't need a tourniquet and they're just bleeding a lot, apply direct pressure. Use gauze, combat gauze, use a bandage to wrap it up, stop the bleeding, okay? I mean, cops will apply tourniquets for the most minor things, and it's aggravating. If you don't see blood, period, you don't need a tourniquet, okay? That's probably a good sign that you don't need a tourniquet. I'm not really in line with the idea of like you'll lose your limb. That's probably not gonna happen. I've never heard of that happening, especially like stateside or in policing, because that person is going to get to a higher level of care fairly soon, okay? So that's not really the issue, but you are gonna aggravate people along the way. You're gonna aggravate the EMT people who are like, why did he do this? This is silly. They actually may remove it, which they told me, which they're not supposed to do, but they're like, it's so obvious you don't need one. We're not gonna leave it on there. And you most certainly are gonna piss off the people at the hospital or the surgeons. So just keep that in mind. I think that officers want to apply tourniquets, right? Because they want to be able to say that they did it, okay? It's just not necessary. So the first thing is identify that the person actually needs a tourniquet. That's important, okay? I went to a scene the other day. There was blood leading up to the apartment all over the place. There was blood on every other person that wasn't injured from the person who was. And when I got there, he had tied some bandanas around his wrist, and it was still dripping blood. I mean, there was just blood all over the place, still dripping blood. I could see part of the tissue in his wrist. kind of through the bandana or, you know, just forward or backward of the bandana where it was seated. It was very obvious he needed a tourniquet, so I applied a tourniquet. And then from there, I moved him downstairs immediately to try to get him to where the paramedics were coming. And by the time we got there, the paramedics were pulling in. Therefore, I didn't really need to do anything else. I just let them handle it. Had they not been there, I would have went to step 2, which is either apply another tourniquet or put a bandage around his wrist, basically apply pressure. I'm not going to take off the thing that he already put on there because that's obviously going to probably cause more problems that I don't need. So I would have, had they not been there, applied pressure utilizing gauze or some other, you know, bandage essentially. So identify whether you need a tourniquet. That's really important. Don't put one on just to put one on. It's aggravating. Now, I'm not going to tell you because you see a lot of blood from an extremity, the arms or the legs, not to immediately go to a tourniquet. I understand why officers do that. I'm not saying that's wrong. However, if you do that, you need to then look for the wound and expose the wound, because if you apply a tourniquet and it turns out that the wound is actually junctional and it needs to be, you know, packed and applied pressure to, we're not actually doing anything, okay? So as an officer, I'm gonna be real pissed if I'm hurt, especially if I'm unconscious, I can't treat myself. If you see a lot of blood coming up from my arm, wearing, you know, basically a t-shirt, and you show up and you throw a tourniquet on there and never look at the wound and it's actually in my armpit and we're just not doing anything. So I'm probably gonna die and that's gonna piss me off. Well, I guess I won't be pissed because I'll be dead, but my family will be pissed. And I've never seen officers pack wounds. I've never seen or know of anybody who has packed a wound out in the real world in policing. But I have seen instances where officers put on a tourniquet and they should have packed the wound, okay? Because it was very obvious that it happened that the officer was wearing like a lighter colored shirt that you could actually see the blood where it was pooling. Even though it was dripping down his arm, you could see that it was a junctional wound. Okay, that's a problem, okay? Because we're not actually treating the problem. If you go on North American Rescue's website, it will basically tell you as the instructions of the tourniquet to apply the tourniquet. I think it says like 6 inches above the wound. We're just gonna apply the tourniquets as high as we can get them, right? So as high as we can get them on the legs and as high as we can get them near the armpit. And the reason for that is because even though we see one wound, right, that doesn't mean there isn't additional wounds that we haven't seen yet. And if we apply a tourniquet here and there's actually a wound above that, again, we're not doing anything, or we're doing something to maybe stop the blood flow from that one wound, but we want to just stop the blood flow in the entire arm so that we can treat any wounds that we don't see. So identify that you need a tourniquet, okay? If you can't see the wound and you do apply a tourniquet, you need to expose the wound because we need to figure out if the tourniquet is actually the thing that we need. Again, I'm not going to tell you not to because I understand why we do that because maybe it's an urgent situation and you want to get one on, but expose the wound so we can figure out if we're providing the right level of care. Whether or not I'm drawing my handgun or I'm doing a ready up drill or taking a corner in CQB, there's a process for how I do those things and I can explain to you what that process is. When you have a process, you get predictable outcomes. The predictable outcome that you want is the thing that you train for, okay, which is the favorable outcome. If you can't explain to somebody in detail how you do something, for example, putting on a tourniquet, then you don't have a process. Is it okay? Yeah, it's okay. But the problem is that when you pull out a tourniquet, now you're just kind of figuring it out as you go. It's not ideal, okay? Also, when you have a process, it helps you get through those situations where maybe you're a little bit excited, maybe your adrenaline's going a little bit. And so if I see somebody that, one, I've identified that they need a tourniquet, then I'm grabbing my tourniquet, disassociating myself with what's going on, and I'm setting up my tourniquet properly to apply it in the way that I have taught myself how to do. And that is to make sure that the red tab is going towards the person's heart. Now, this is important because you're less likely to get the windlass caught inside their arm or inside their leg, which is gonna make it more difficult on you. Not impossible, just gonna make it more difficult. But more importantly, if I'm the patient and I'm standing from your perspective looking at me and I set it up this way, right? Now, if I am hurt myself, I am also doing the same thing. I'm pulling my tourniquet out, I'm making sure the red tab is facing towards my heart, and the reason I'm not going to use this one because this is a good tourniquet, that's important is because I'm going to be able to get the leverage I need to pull this tourniquet tight versus if the tourniquet was inside my arm this way, I may not be able to push the tourniquet as far away from my body depending on how you kind of have the tourniquet on here. Which brings me to my next point that's important. When you get the tourniquet on somebody's arm or leg, cat tourniquet, make this thing as tight as possible before you even utilize the windlass. The tighter that you get the tourniquet and you pull that tourniquet on that extremity, the less work you're gonna have to do on the windlass. So if you put on a loose tourniquet or just kind of snug on there, you're gonna have to turn the windlass a lot more to get it tight. So make sure that once you do get the tourniquet on there, pull that thing as hard as you possibly can. Just to recap, 1, identify that you actually need a tourniquet. 2, when you retrieve your tourniquet, what I do, and I suggest that you do as well, make sure the red tab is facing towards that person's heart. That's gonna set you up to not only make sure you're applying it to them correctly, but make sure that in situations where you're hurt, you have a process so you're applying it to yourself correctly. And 3, once you put that tourniquet on there, pull that thing as tight as you possibly can so that you don't have to do extra work with the windlass. Chest seals are really easy to use. I think that they're dummy proof, and if you happen to not understand what's going on, you can pull it out and there's usually going to be directions on it and tell you how to do it. But if you open this thing up and you need it, there's just really no way that you can screw it up. It is going to come with a piece of gauze. If there's a lot of blood, you do kind of want to clean that off so that it allows the adhesive to stick onto the person's chest backside wherever you're applying it. So where do we need to apply it? When is it appropriate to apply a chest seal? As a good rule of thumb, if you see a hole or puncture wound anywhere above somebody's belly button, it's probably okay to put on a chest seal, okay? In certain situations, do you know that they need a chest seal? Are they labored breathing? Doesn't really matter. Just put on a chest seal because by putting one on, you're not going to hurt anything, and you're also going to mitigate any potential problems that may arise. So I had an individual who had stabbed himself in the chest with a steak knife, and when I got there, he was conscious. He was not talking, maybe by choice, I guess. He hadn't slept or eaten in 3 or 4 days. So I put on a chest seal. The steak knife had blood at least halfway down the knife, so I know it went in pretty far, but he wasn't labored breathing or anything. Doesn't really matter. Let's just put on a chest seal because it's not going to hurt anything. So the paramedics got there, loaded him up, and I went to the hospital where he was to do some more paperwork essentially. So any holes or puncture wounds above the belly button, just throw on a chest seal. You're not going to hurt anything. Don't worry about not knowing what to do because once you open this thing up, it's pretty obvious. The adhesive is kind of annoying. Like it'll stick to your hands, it'll stick to itself, but it's not going to be permanently stuck there. It's not going to be permanently stuck to itself, and you will be able to kind of unpeel it and get it to where it needs to go. Chest seals, very basic, very easy to use, and you should carry at least 2 of these at all times. Gauze or combat gauze. Combat gauze is better, usually, well, definitely is a lot more expensive. Combat gauze is going to have some chemical agents inside of the gauze itself that are going to help coagulate the blood and stop the flow of blood probably faster. And if you can get your hands on that, it's way better to use than just regular gauze, but regular gauze will work just fine. I did have actual combat gauze here that I was going to show you. However, I think my kids ran off with it and I can't find it at the moment. So regular gauze will work just fine. I have never seen, again, I've never seen officers actually pack a wound on the street. I have seen situations where they probably should have. So keep that in mind and make sure that you're exposing the wound. The purpose of this video or these clips here is not to demonstrate how to pack a wound. The purpose is for me to actually just show you why you should probably wear purple gloves or blue gloves instead of wearing black gloves. Black gloves are going to make the blood harder to see on your hands, which means it's going to be harder for you to assess where the injury is or if they're actually bleeding, especially at night. And secondary to that, because you're not actually seeing the blood on your hands with the black gloves, that might mean that you start doing other things with your hands, forgetting that you actually have blood on your hands, like keying up on your radio or getting into your police car, and before you know it, you kind of have blood all over the place before you realize that you're actually putting blood all over the place. That being said, if you do have the opportunity to pack a wound, you really want to be applying pressure constantly the entire time. So that may start with you putting your finger inside the wound and then following your finger inside the wound with your finger full of gauze, and then simply replacing that finger with another piece of gauze every single time, maintaining constant pressure. Once you fill up that wound with gauze and you've covered the surface with gauze, then you want to apply pressure with your hands as long as possible to ensure that the bleeding has stopped. Emergency trauma dressing is, in my opinion, not something that I think is absolutely necessary for you to carry on you. The only thing it really allows you to do is to apply pressure to the wound and then secure the bandage to itself. So you can wrap the wound up tightly and then secure it to itself, allowing that pressure to be maintained without you having to actually physically hold on to the wound. Now, if you feel like you need this, then there's a good chance that maybe we didn't apply a tourniquet correctly, or maybe we need an additional tourniquet. In the situation I had where the individual was cut from the wrist and I had moved them from the apartment down to where the paramedics were arriving, when I had got to the box and the paramedics were looking at him, I noticed that his wound was still dripping blood. The paramedic didn't even use trauma dressing. He just used regular gauze. He wrapped it up and then he secured the gauze against itself. I asked if he felt like we needed an additional tourniquet and he said no, and his reasoning was just because the wound was not bleeding bad enough at that point. So he's a professional. He definitely knows way more than I do, and that's his decision to make. But emergency trauma dressing, absolutely necessary? I don't think so, but it can be okay and beneficial for you to have. I do want to cover one more thing that I see that I think is really important and you need to know how to do. And that is, if somebody is shot or stabbed or has an arterial bleed from their in their neck, one, there's not a whole lot that we can do to really help that person per se, because they need to get to a surgeon quickly. But we can do something, and that something is not wrap the bandage around that person's neck. Now, when you start doing that, wrapping the bandage around their neck, you're probably going to realize that you can't wrap the bandage tight, because then you're going to choke that person. And that is the problem. The problem is that now you're realizing, I can't actually apply pressure to this wound because I've wrapped it around their neck. How do we treat that? If the wound is on the left side of their neck, you're just going to wrap the bandage around their neck and then come across their body and underneath their armpit. We're going to do that, and we're going to continuously apply pressure, certainly, to this type of wound. It's not something that you want to wrap and be like, okay, it's good. This is a serious problem that requires immediate significant medical attention, and they need to basically get to an operating table as fast as you can. So if it's a civilian, you know, we're going to wait on the box to get there, or a citizen, sorry, some people don't like when I use the word civilian. A citizen, we're going to wait on the paramedics to get there. If it's an officer, maybe you make the decision that we don't have time for that, and we're going to put them in our police car and go directly to the hospital. And if we are going to do that, you better have somebody that is assisting the officer and applying pressure to that wound. Again, got to get that person to a trauma center or a surgeon as quickly as possible. Time is not on your side, and even if you do all that, there's a good chance that they won't survive. I do want to share a personal and professional story with you all, because I think that you guys could learn something from this. Like I said, as a police officer in a major city over the course of 10 years, you're going to see a lot of people hurt in a lot of different ways. And not that long ago, less than a year ago, by now, maybe 6 months ago, I was dispatched to what was basically a shooting, or sounded like a shooting, a shootout. And when I got there, there was not a shootout occurring, and somebody basically yelled to me that an individual shot themselves, which is obviously, not at the moment making a lot of sense, and that they were down. She kind of pointed to where he was. And I stopped my car just short of where she said the person was, because she was across the way of the parking lot, pointing across my car, saying, in between these cars or whatever. And so I got out, I drew my gun, and I approached this person to find that this person was shot in the head. And obviously the scene was secure. There was no shootout occurring. again, this is kind of confusing because you're getting reports of a shootout, and then you get there and you see a person shot and somebody telling you that that person shot themselves. So obviously you're just taking in the information as you're getting it, and you don't have all the pieces. But like I said, the scene was safe and secure. So we saw the firearm was actually in the person's hand, and this person was still alive. Now, this person was shot in the head with a .40 caliber handgun. And essentially what I had to do is, figure out the best way to help this person. This person is still alive, right? So obviously when you're shot in the head, there's not a lot that we can do to keep things in order, right, on the head. What can we do? Well, we can essentially do that. Try to keep the head together, for lack of a better way of saying it. And as this person was laying on their side, I could only see the entrance wound, and there was not a lot of blood from the entrance wound itself. So because there's not a lot of blood there, not really my primary concern. Essentially what I did is I got down. Obviously I had gloves on, I had gauze, and I was able to get underneath that person's head with the gauze in my hand and essentially hold their head in my hand. Because of the way that they were laying, which is already in the recovery position, which is a good thing, and the weight of their head and me trying to hold their head up, which somebody that's dead weight, I think your head is like the heaviest part of your body or something like that. So the weight in itself and gravity was allowing me to kind of just hold pressure on there, right? I never actually saw this while I was treating them or trying to apply medical attention. I never actually saw the wound, right? Because I wasn't going to move it around or do anything, keep them in the recovery position and allow gravity to just do its thing and apply pressure that way. This person, although alive, was labored breathing, and very shortly it became apparent that they were basically choking on their own blood. So what can we do in that situation? Well, I'm already holding the person's head with one hand. The only other option to prevent them from choking on their own blood was for me to stick my hand inside their mouth, and essentially what I ended up having to do is place my thumb in between their upper jaw and their lower jaw, their teeth, to prevent them from biting down, because his jaw was basically trying to clinch, essentially. And so it was not comfortable, but it wasn't hurting me. So I had to do that. So I had my hand holding their head together, basically, and my other hand inside his mouth with my thumb in between his teeth, trying to clear his airway, basically, trying to give him the best opportunity to continue breathing. And in a few minutes after that, I'm not sure how much time had passed, the paramedics showed up. I continued in that position. I'm holding his head, hands in his mouth, letting them know, what I have, essentially. And they very quickly got him onto a gurney. And I continued to do my job until the paramedics said they didn't need me anymore. And I'm actually verbalizing that to them. I'm telling them, let me know when you don't need me, right? And essentially I, lost custody and control of the situation once they said, yeah, we got him, which was basically at the point in which they were putting him into the paramedic or the box. And, obviously when you're shot in the head, there's just not a very good chance that you're going to survive. This individual did not survive. Several days later, he passed away. And that's just the job, okay? These are the things that you can expect to expose yourself to if you're going to be a major cop in a major city. And I hate to use the word normal, but that's the way that I approach these situations. Like, my heart rate doesn't feel elevated. I don't feel like I have an adrenaline dump. I just go into work mode or provide trauma care mode and do what I can to help this person. And just a little bit more of the story, because it's not an ongoing investigation. I'm not going to give you specific details anyways. What ended up happening, oddly enough, is there was a shootout between these two people, which we observed, we'll just say that, actually happening, recovered shell casings from different perspectives. but that individual did not get shot by the other person. He did shoot himself. And very, very, odd situation. My guess is that that individual at the time, that this confrontation started, he was already going through something, and that kind of was like the last straw, essentially. So he was not shot by somebody else. There's a lot of cars shot up and other things shot up, but he was not shot by somebody else. He actually shot himself. If you're not subscribed to this channel, I think that's kind of weird. You can do that by tapping on this photo. And if you'd like to support the channel, make sure that you feed the algorithm down below. Share this video with your friends so that they can also have the information, and leave me a comment in the comments that I typically respond to, if you guys know that. And let me know what your own experiences are and things that you've seen and ways that you've kind of treated and handled those problems.